CJD is named after the German psychiatrist who first described the disease in the 1920s. It, along with other similar diseases, is classified as a TSE. Under a microscope, infected tissue, generally the brain, has a sponge-like appearance. The CJD affects about 1 person per million worldwide, with approximately 200 cases seen in the U.S. each year. CJD has a relatively long incubation time, up to 30 years, during which the disease is unnoticed. Therefore, patients with CJD who have brain or spinal surgery may contaminate instruments with the infectious agent. This makes plans and policies for control of CJD very important. In infected patients, prions are most frequently found in the brain, dura mater, the tough membrane that encases the nerves of the spinal cord, and eyes. They are also detected less frequently in the cerebrospinal fluid, spleen, lymph nodes, kidney, and liver. Seldomly, they are located in blood, urine, skin, muscle, bone, the adrenal gland, heart, feces, peripheral nerves, nasal mucus, gingival, saliva, sputum, and tears. When a suspected CJD patient undergoes a procedure, all healthcare professionals involved with that patient must be notified, and the facility's CJD policies and procedures must be followed. Cleaning and sterilization of items contaminated with prions is a challenge, as prions are difficult to remove or deactivate, and standard cleaning and sterilization procedures are ineffective against prions. Whenever a suspected CJD case is scheduled for an invasive procedure, the following actions should be taken. Inform a department manager as soon as notification of a prion or potential prion procedure is received. Immediately contact Infection Prevention and Control to determine which cleaning and sterilization guidelines will be followed at your facility. Currently recommended guidelines are published by the World Health Organization, the Centers for Disease Control and Prevention, and Society for Healthcare Epidemiology of America, also known as SHEA, S-H-E-A. Current guidelines are reviewed and updated as new knowledge regarding prions is gained. And also ensure that the most current cleaning and sterilization information is available in the facility you are working. Instrumentation regarding prions. Due to the difficulty in cleaning and sterilization, disposable instruments should be used whenever possible with prions. All current guidelines suggest disposing of reusable instruments that have become contaminated with high-risk tissue, such as brain tissue, dura mater, spine, and eye tissue. Reusable instruments will likely be damaged or completely destroyed during the stringent cleaning and sterilization protocols. Heat and moisture-sensitive items should be used, as they would probably be destroyed during cleaning and sterilization. Also, some facilities will quarantine instruments used on suspected CJD cases. This is done as a precaution while awaiting a diagnosis. And finally, environmental surfaces. Surfaces such as countertops that have become contaminated with prion materials should be cleaned following the most current published protocols. And contaminated non-critical equipment should be cleaned following the most current published guidelines. Prion-contaminated instruments pose a special challenge to CS professionals. Careful attention to the most current published guidelines for cleaning and sterilization is the most important factor for your safety and the safety of patients and co-workers. Additional note. Additional information about CJD can be found on the World Health Organization and SHEA, Society of Healthcare and Epidemiology of America websites, and in AMI ST79, Annex C, and from the CDC website. Controlling and eliminating microorganisms. To prevent the spread of the microorganisms that can cause disease, healthcare settings must practice microbial control. The Departments of Infection Prevention and Control and Central Sterile, in particular, are vital to microbial control and patient safety. Every time an instrument or device enters a patient's body during an invasive or minimally invasive procedure, there is a risk of infection. This risk is increased because many items used in patient care and treatment are processable. They are used on one patient, processed, and then are used on another patient. It is up to the CS department to control the spread of microorganisms from one patient to another through proper instrument cleaning, disinfection, and sterilization. It is important to remember that even if you cannot see microorganisms that can pose a significant threat to humans, let's compare microorganisms to seeds and draw some comparisons. There are many varieties of seeds, and each produces a different plant. Seeds must have the right conditions to grow and continue living. Those in a proper envelope at the store will not germinate and grow. See figure 4.30 as an example. However, when they are placed in the right conditions with proper soil, water, fertilizer, warmth, and sunlight, they grow and develop. In the same manner, there are many varieties of microorganisms, and each can produce a specific effect, an infection or disease, when they have the right conditions for growth and reproduction. CS professionals should be able to recognize the conditions that favor the growth of microorganisms and learn to see microorganisms in the workplace. For example, the decontamination workstation in the left side of the image in 431, refer to 4.31 for this, looks safe to the untrained eye. However, if microorganisms were easy to see as plants, that same workstation might look like the photo on the right. Again, see 431. Microbial control is a complicated endeavor. Just as microorganisms differ in their needs for growth and reproduction, they also die at different rates. The type of microbial control used against an organism varies according to how susceptible the microbes are. Some pathogens are more difficult to kill than others, and that is one reason why disinfection, sterilization process are so complex. Microbial control can also depend on whether the goal is to kill a pathogen causing infection through antibiotics, inactivate or kill microorganisms on the skin through antisepsis, or in the case of central sterile, kill pathogens on medical instruments or devices that will be used on patients. In addition to microbial susceptibility, the vast array of items that must be processed is another reason why no single disinfection or sterilization process can kill all microorganisms. A common question. You receive a case cart from the operating room to the decontamination area with a note stating instruments are contaminated with hepatitis B or MRSA. How will you handle the instruments? Answer. All instruments, except those contaminated with prions, are to be cleaned following the manufacturer's instructions and the facility's cleaning procedures. Items contaminated with prions have special cleaning and handling requirements. Conclusion. Having a basic understanding of the principles of microbiology and learning about bacterial and non-bacterial organisms and how they can be transmitted helps central service professionals understand the important role they play in preventing disease. Terms to remember: microbiology, contamination, pathogen, micron, aerobic, anaerobic, endospores or spores, pH, cycrophiles, bacteria, mesophiles, bacteria, thermophiles, also bacteria, vegetative stage, angstrom, binary fission, and prion.